Welcome, everyone. Thank you so much for joining us on this for this program about childhood asthma. I'm Joan Spurl. I'm director of Dolly Parton's Imagination Library at the Literacy Cooperative. We're Dolly's local program partner. Dolly relies on a local organization to make the program available to every child under 5 in a particular community and zip code by raising the money for it locally and then managing it. And we are thrilled to do that for Cuyahoga County. And again, as Dolly has said, you can never get enough never enough books into the hands of enough children. So we embrace our work doing that. Um, I'm assuming that some or many of you might have children enrolled in Dolly Parton's Imagination Library, and if you don't, or even if you do, please help us spread the word. Again, we make a commitment to Dolly thank you, to get as many children enrolled in our community as possible. We know that it's making a difference. And then to add value to it, we are happy to be able to provide programs like this um, that we are sharing with families to promote your children's well-being. So I am thrilled to introduce Yvonka Hall, our presenter tonight, um, who is a nationally recognized award-winning health disparities expert. She's the executive director and founder of the Northeast Ohio Community Resilience Center, through which she has turned personal tragedy into lifelong purpose. Yvonka holds a Master of Public Administration from Texas Southern University and a Bachelor of Arts from Notre Dame College. A proud graduate of Cleveland's John Marshall High School, she was inducted into its Alumni Hall of Fame in 2019. Yvonka has been recognized with numerous honors, too many for me to list all of them here, but let me share a few that just came in the last week or so. She's a Robert Wood Johnson Fellow. She received the 2025 Community Impact Award from the National Association of Chronic Disease Directors, the 2025 Who's Who in Black Cleveland, 2024 Health Innovator to Watch by the Boston Congress of Public Health, 2024 Cranes Cleveland Notable Leader in Healthcare, and she was named an Everyday Hero by WEWS News 5 in Cleveland. So she has a lot of important information to share with us. So I'm going to go ahead and mute myself and take myself off video for now, and then I will help manage Q&A through the chat later. So we will have the presentation first, and then we'll have some time for Q&A for folks. I might have some questions. So having developed asthma as an adult, so which is managed now. But anyway, here we go. Thank you, Yvonka.
Thank you for having me, Joan, and thank you to the Literacy Cooperative, particularly Parton's, Imagine Library. I think it's so important for our young people for us to get them started early with the reading and the love of reading. I was one of those students that loved reading, and my grandfather made sure that I always had the dollars I needed for like the different reading clubs and things to participate in. So that was important to my family. And I also developed asthma um, as an adult. I'm sure I may have had it as a child and we just didn't recognize it. But I'm going to talk a little bit about asthma awareness, the building block for a better tomorrow, talking about childhood asthma and why it's so important. Some of the references that I use that I didn't put at the end of the presentation is information from the American Lung Association, the Asthma Foundation, the Ohio Department of Health. They have an asthma project that the Northeast Ohio Black Health Coalition has worked with a number of years. And so I like this whole thing around building blocks. So the Northeast Ohio Black Health Coalition was the former name of my organization, and we are now the Northeast Ohio Community Resilience Center. As you know, we a lot of organizations have kind of changed their names over these last few months, but we have not changed our mission. So our mission is still to educate communities of concern regarding the social, structural, environmental, and behavioral determinants of health. And for us, we do all of that by working to educate, advocate for, and empower the community. for us, our goal here this evening, and I thank you all for being here this evening because I know how evenings are. I once had little ones, and now I'm a grandma. So in the evening, your houses are busy. So our goal is to educate faith, community leaders, youth, members of the community, communities of concern on air quality issues, and raise awareness about asthma. That is so important to our communities, and particularly for where we live. Our objectives are to provide resources and strategies um, to priority areas that are disproportionately burdened by high incidence of asthma. Cleveland is one of those priority areas. When we look at the rates in Northeast Ohio, they are alarming. And so, because of that, that's why it's important for us to have our discussion here tonight. We find the exhale strategies, which is a strategy that we use and that other states use when we're looking at how do we talk about asthma. We want to provide communities with the local impact of asthma in their communities and introduce the community to marketing materials focused on asthma. What is asthma? So when we look at asthma, we know that asthma is a condition that causes long-term chronic inflammation in your airways. The inflammation makes them react to certain triggers like pollen, exercise, cold air. The weather is changing, and so you may find yourself walking outside and all of a sudden starting to cough. During these attacks, your airways narrow, and so you have a bronchial spasm. They swell up and they fill with mucus. It makes it hard for us to breathe and it causes you to cough or wheeze. Without treatment, these flare ups can be fatal, and that is important for us to understand about asthma. Why we need to talk about asthma, we have to understand that health outcomes for asthma remain high in Ohio and nationally. Insights from Ohio family and from social conditions impacting wellness, healthcare, and social services delivery models, as well as policies and practices is critical to understanding what changes are needed to address inequalities and to help families thrive. Like, what can we do to address asthma? Because we know that asthma is a chronic illness among children and youth in the United States. On average, in a classroom, about 30 children, three are likely to have asthma. And many of those children have had an asthma attack or an episode during the preceding year. So, that previous year, they've had an episode with their asthma. And so, according to the CDC, asthma is also the leading cause of school absenteeism. So, we have a lot of children that miss a lot of days because of asthma attacks. Asthma cannot, if you don't remember anything else, make sure you remember that cannot be cured, but it can be controlled, which is will lead to a better quality of life. I have had family members that said, I grew out of my asthma. You do not grow out of your asthma. You may not have as many attacks, but you did not grow out of your asthma. So make sure if that is the one takeaway, that is the one thing that why we need to talk about asthma. Because we have a lot of adults who say, oh, I don't, have that anymore. And so we talk about this burden of air pollution. So when we're talking about asthma, we have to talk about some of the other things that kind of trigger it. The health burden of air pollution is not evenly shared. Some people are at more risk for illness or death from air pollution than others. The key factor that affect individuals' risk includes exposure, where we live. Where we live is important. Where we go to school, where you work, makes a big difference in how much air pollution they breathe. In general, the higher exposure, the greater risk of harm. The other thing is looking at, when you're talking about where you live, are you close to factories? Are you close to the highway? Looking at all of those things and taking those things into account. Do you live in a place that services buses where you're in close enough proximity where all of those things are right there at you? Do you live near a gas station? All of those things should be taken into account. Susceptibility, individuals who are pregnant, and their fetuses, children, older adults, and people living with chronic conditions, especially heart and lung disease, may be physically more susceptible to health impacts of air pollution than other adults, which means that their lungs are also compromised because of the health issues that they are going through. The other thing I tell people about asthma is, we used to have this whole big thing around going to the hospital to visit people and not wearing perfume. And for some reason, they don't even talk about that anymore. But the big thing of it is, if the person can't breathe and you have on a bunch of perfume and you're literally right in close proximity to them, then you're not helping them. So The other thing that we talk about when we talk about these burdens is access to healthcare. That has been a big buzzword in the news today and recently, talking about healthcare coverage, how much it costs, and these rates of cost. So, looking at whether or not a person has healthcare coverage is important when we're talking about asthma, whether you have a healthcare provider. Because if you have someone who has looked at you for a long time, they're able to understand the things that are going on with you. And so you're not new to them. So, make sure that you get a primary care physician. Make sure that your child is going in for their well child visits, that they have a doctor who sees them continuously so they'll know, what's going on. And ask the access to linguistically and culturally appropriate health information may influence their overall health status and how they are impacted by environmental stresses like air pollution. We talked a little bit about air pollution. Psychosocial stress, there is increasing evidence that non-physical stressors such as poverty, racial and ethnic discrimination, and your residency status can amplify the harmful effects of air pollution, which means it amplifies the impact of you possibly having asthma. These risk factors are not mutually exclusive and often interact in ways that lead to significant health inequities among subgroups of the population. Children are both more susceptible to harm from air pollution and are more likely to be exposed than adults. The growth and development of the child's lungs and breathing ability start in utero and continue into early adulthood. Long-term exposure to particle pollution during pregnancy and early childhood have been linked to reduced lung growth, and long-term exposure to ozone has been linked to increased potential for the development of asthma. The developing brain and heart may also be affected with lifelong consequences. In addition, the body's defenses that help adults to fight off infections are still developing in children. So even though we want to say children are little people, children are still growing. Children have more respiratory infections than adults, which also seem to increase their susceptibility to air pollution. And so think about air pollution. A couple years ago, this summer we had the California wildfires. Although they were not as bad as last summer. So how many, I wish I could say how many people in the room remember walking out in your yard and thinking that your neighborhood was on fire, and then realizing that okay, the smoke is all around me. And so I thought about people who could not breathe during that time. Like, do they know they need to wear a mask? Do they know their children should still be having a mask on? Children breathe more rapidly and inhale more air related to their size than adults because their lungs are still developing. They are more likely to spend time outdoors, running around, being active, and breathing hard. I mean, have you ever heard, when kids are running around, they come to you and they're like my grandkids are like dramatic. I'm like, are you all okay? Consequently, they are more exposed to polluted outdoor air than adults typically are. And so we have to be careful when we're talking about where our children are playing, where they're doing activities at, where's their school, when they go out on playtime, what are the other industries that are around the school? Are they tearing down buildings around the school? Are they using wetted standards? Wetted standards is if they're tearing down a building, they're supposed to be following it with a water hose, right? And so when you see buildings being torn down in the inner city and you don't see a water hose, all of the things from that building are being spread through the community. So when we talk about the United States and the conditions for the millions of people in the U.S. living in with illnesses such as asthma, COPD, diabetes, heart disease, lung cancer. Exposure to air pollution places them at a greater risk of harm to their health than those without the disease. This can result in the worsening of their symptoms, increased medication use, and more frequent emergency room visits and hospitalizations, and overall reduced quality of life, and far too often premature death. So I want you, I try to put pictures in that I can make sure that you kind of understand. So this picture here talks about this urban heat island effect, the role of trees in mitigating them. And so if you look at where the city is, right? And so the city says it's 40 degrees Celsius, right? There are no trees. If you look at the urban residential area, 36 degrees, still no trees. If you look at the park area, the park is 6 degrees cooler than the city, and that is because the trees. The trees are actually the umbrella that's keeping all of the other toxins from getting to the communities that's there. So they're serving as your umbrella. When we talk about suburban residential areas, they have more trees, but not as many trees as in the park areas. When we talk about the suburban residential areas um, that have trees, they're a lot cooler than the city area. And then we talk about these rural areas, rural farmland. So rural areas in itself are a lot cooler. But the rural farmlands, because they are actually planting more on them, so they have less trees, is a little bit warmer. And so this whole urban heat island is the heat is coming from the top and coming from the bottom. So you're getting the heat both ways. And so if you live in the inner city, when the sun is shining, you're getting the heat that's coming to you from the top and from the bottom. So you have no buffer. There's nothing that's keeping all of that heat away from you. And that's important. So where I live in the middle of the city. I live in Cleveland. I live on Harvard, but I have a house that is an anomaly. I live on an old farmhouse that is surrounded by a bunch of trees. So when you come into my yard in the summertime, it is literally 10 degrees cooler in my yard than it is at the gate. So once I hit the gate and go outside of my gate, it's hot because there are no trees that line the Harvard Avenue. So when you go up Harvard and you look, you don't see the treescape that's there. So hopefully you all are imagining your neighborhoods too. And if you don't believe me, leave out of your neighborhood. If you drive, go on the highway and go to a suburb up. So as you're leaving out of the city, you will notice that you see houses. But when you go to the suburb, what you'll notice is that you see trees. So you'll see the trees from the highway, but as you're coming back home, what you see is the homes. And so that means that those homes are not protected. And that means that the residents in those homes are not protected. So more likely for them to also be exposed to other kinds of toxins, which leads to asthma attacks. These common asthma triggers, when we talk about people having asthma attacks, asthma is a serious lifelong disease of the lungs that is caused by swelling and inflammation in the airways. I'm going to keep saying that. That's why I had it at the beginning. That's why I have it now. And I said it's lifelong, which means there is no cure. So repeat after me. There is no cure. It can cause breathing problems known as asthma attacks, and can cause wheezing, cough, and a shortness of breath. And so when you look at some of the triggers, you see secondhand and wood smoke. But I tell people firsthand, secondhand, and third hand smoke. So you have the first hand smoke, which is the person smoking. You have secondhand smoke, which you're breathing in somebody else's stuff. But third hand, which we never really talk about. So it's where people smoke, and they like touch things that are in your house, like their pillows, and so they're there sitting on your couch. And so their smoke residue from them is being left on your pillows, on in your car. And so that means that you're still breathing in third hand smoke. Dust mites, we might have homes that have mold. I just talked to people about flooding in Warrensville, Maple Heights, Garfield Heights, and East Cleveland, Warrensville, Maple Heights, Garfield Heights, and East Cleveland, because there is a number of communities that have floods, even though East Cleveland doesn't have as high a risk as Garfield Heights, for one, which is the Cleveland side of Garfield Heights. I talked to them about their risk around mold because of all the water. Cockroaches and pests. Um, Cockroaches, definitely trigger asthma attacks. They do the rubbing of their feet, whatever they want to call them. They rub together and it kind of spreads the toxins through the home, but also bed bugs. So I know that we've had some issues with bed bugs in urban areas or in a lot of areas. And so people try to get rid of them. So what do you do to get rid of cockroaches? And what do you do to get rid of bed bugs? You spray, right? And so some people go out buy bombs and they set them off in their house. And what they don't realize is that they have now triggered asthma because they literally close all the windows in their house to set off something to get rid of a pest. And now they come back into their house and the windows and stuff are closed and all of those things are still there. Now they're on your furniture, on your clothes, on everything else that you have. Pests, pets. So some people may have cats, some people may have dogs, some people may have hamsters. So they may have some other things that are some triggers from asthma. So I had a cat. Even though I was allergic to him, I loved my cat, which was my son's cat, and then all of a sudden, it became my cat. Nitrogen dioxide, outdoor air pollution. We talked a lot about that. I try to talk about that because of where we live. And chemical irritants. I just talked about some of them. The other one can be like things that you use for cleaning your home. Like we all want our house to be nice and fresh and clean. And so we buy these things and we're like, oh, if I use, a little bit, it's going to be clean. But if I use a lot, it's going to be like clean and fresh. And so we start spraying things and pouring things. Case in point, years ago, I don't know what I was thinking. I went to clean something and I poured this abrasive cleaner on it, cleaned it off, and then I went to go do something else and I had ammonia and I poured it on there. Well, the abrasive and the ammonia mixed and became their own chemical. And all of a sudden, I was literally chased out of my apartment. I had to like run because when it hit my lungs, I'm like, oh, I cannot breathe. And so, thinking about the things that we're mixing, when we're mixing things in our water, because I know a lot of people put bleach, a lot of people use a lot of dishwashing detergents and other things. They use things that smell good. I know on one of the other things in here, I'm talking about candles, because I love candles. But I realized that every time I would, burn all these candles, I would start not feeling well. And it's because it was causing me to have an asthma attack. And so understanding that the asthma awareness is important. People with asthma can live normal and active lives. There is no cure for asthma, and you can't outgrow it. So we're going to go back to that again. You cannot outgrow it. Some people may stop having asthma symptoms for a while, but it may seem like they have outgrown it, but it isn't gone and could come back at any time. And they also have exercises that you can do to help strengthen your lungs, like these deep breathing exercises. And I know if you ever spent any time in the hospital, they give you the little poxometer machine where you like blow into it and they say, here, every 15 minutes, blow in here, blow as hard as you can, trying to help your lungs to do some of the things they do. They also have like yoga for people with asthma, where you're going in trying to figure out how you can help yourself in, with deep breathing exercises and different things like that. So, that's important. And so when we talk about the American Lung Association, so the American Lung Association issued a report um, a few months ago in 2025 about the asthma rates and the ozone and particulate in urban communities. And they issued a report for us, for Cuyahoga County. And Cuyahoga County received a grade of F in every single piece of this report. It ranked the 50 worst for high ozone days out of 228 metropolitan areas. It ranked 46 worst for 24-hour particulate pollution, and that's that small matter pollution, like things that are smaller than a pen tip, right? It ranked ninth worst for annual particulate pollution out of the 208 metropolitan areas. A grade of F, y'all. We got a grade of F when we talk about our air quality and the things that we're breathing in this region every single day. And so when we talk about this, for me on my end, I go to city council and say, I need you all to fix our air quality code so that we can make sure that these major polluters aren't polluting our communities and it's not killing ourselves and our kids. And they will not pass the legislation. Um, because our legislation around air quality, our air quality code in Cleveland, Ohio, has not been changed since 1978. And most of the air quality codes in this region have not been changed since the 70s. So we have a high rates of childhood asthma and air pollution in African American communities. And so when we talk about these solutions, what's the impact? So that's part of what we've been doing here is like what do we get? How do we get to um making sure that our children can breathe. And so part of that is this exhale strategy. I talked about it when we first started. And so this strategy, the first E is education. Education on asthma self-management. It is important for us to be educated about what asthma is and what it is not. The X is for extinguishing smoking and exposure to secondhand smoke. That means that anybody that smokes, your friend, that they cannot come in your house smoking. That they cannot come in your house smoking. Home visits, home visits for trigger reduction and asthma management education, achievement of guidelines-based medical management, making sure that you're going to the doctor, making sure that you're following through, making sure that you have your inhaler. We were getting a lot of people who during COVID, all of a sudden they're like, oh, I can't breathe. They had asthma and now they hadn't had an inhaler in years because they're like, oh, my asthma went away. This linkages and coordination of care across settings. Do all of your doctors know about your health status? Do they know about your children's health status? And making sure that your coordination is that you're not going from doctor to doctor to doctor, that you find you a primary care physician that can help follow you to help to improve your better quality of life. Environmental policies. I just talked about this air quality code. I've been working in Cleveland, also in Akron. I was there with them talking about the air quality code. In Youngstown, the same thing. Or best practices to reduce asthma triggers from outdoor, indoor, and occupational sources. We have to make sure that we're doing everything that we can to protect future generations. Like for me, I'm a grandmother. And so I don't want my grandchildren to go through the things that I've gone through um, with my asthma. Research has shown that each exhale strategy can reduce asthma symptoms. It can reduce your asthma attacks, asthma related hospitalizations, and emergency department visits, which are high. Like if you only knew how many people are going to the hospital because of asthma related hospitalizations and emergency room visits where they're like, literally, I cannot breathe. I do not have my inhaler. When was the last time you had it? Oh, I haven't had any in a while. Do you have an inhaler? Nope, I don't have one. I need to have one. So we have to make sure that we're going to the doctor. The number of days that people are missing from work and school because of asthma. Remember when I started off, I said asthma is the number one reason that children miss school. It's also a big reason why people miss work. Limitations on activities because of asthma. There aren't a whole bunch of limitations on activities if your asthma is controlled. But if your asthma is not controlled, then you're gonna have a limitation on your activities because you literally can't breathe when you're trying to do stuff. And so this exposure to asthma triggers can cause asthma symptoms or asthma attacks. Common asthma triggers, we talked about it: smoke, dust mite, roaches, furry pets, mold, disinfectants, air pollution, um, having a respiratory infection like the cold or flu. We are in cold and flu season. If you have not been vaccinated, be vaccinated. These are common triggers. Indoor triggers. Did y'all know that a gas stove will trigger asthma attack? So if you have a gas stove in your house and you put a carbon monoxide detector in your kitchen, it's going to make your carbon monoxide detector go off. So I changed over my stove to an electric stove. My great grandparents had always used an electric stove. I don't think that they knew the correlation between that and asthma, but they had always used the electric stove. And then when we came to Cleveland in 1954, my family started using gas stoves, but my families down south still use electric stoves. We talked about bugs and roaches, candles. I talked to you about perfumes. That's a big thing. I love perfume. But when I go see my brother, I'm like, I can't spray the perfume on because it's going to cause him not to be able to breathe. There's some evidence suggesting that current and former smokers are at a greater risk for health harm from exposure to the fine particulate pollution compared to people who've never smoked. So that's that PM 2.5. So these are these small particulates that are smaller than a pen tip or a pencil tip. Smoking damages the lungs. And so when we talk about smoking, understand that if you live in Cleveland, Ohio, and Cleveland, Ohio has the highest rate of smoking in the United States. More adults smoke in Cleveland, Ohio than in West Virginia. 35% of adults in Cleveland, Ohio smoke. Insane. Insane. In West Virginia, the rates are 11%. And so, looking at what smoking does to your lungs, your heart, your blood vessels, and your other organs, this impairment leaves the person with smoking history more vulnerable for health impact of air pollution than a never smoker, than a person who has never smoked. So, looking at that, and then how do we control asthma? When asthma is well controlled, you or your child will have fewer symptoms, such as wheezing or coughing. You will wake up less because of asthma, um, will miss less work or school because of asthma, can take part in more physical activities. Because remember when I told you that if asthma is controlled, you can do physical activities. You can do a lot more because your asthma is under control. You will not have to go to the hospital because of asthma. So we have far too many people who are at the hospital because they're having an asthma attack because they have not used an inhaler in years or have not refilled a prescription or filled it in the first place. They said, I feel better, and that is it. You can control asthma by knowing the warning signs of an asthma attack, staying away from things that cause an attack, and taking asthma medication exactly as prescribed by your physician. So don't, if your doctor said you need to take this every day, you should be doing it every day. If you have to do an inhaler every day, you shouldn't go, I did that for 3 days. I feel fine. I'm good. I don't have to do it anymore. You want to make sure you're doing it exactly the way your doctor told you. Remember, you can use Exhale, which we talked about early, to reduce your asthma symptoms, to prevent asthma emergencies, and to avoid missing work or school because of asthma. Um, and that is it. Do you all have, hold it, let me go to the last one. Do I have one? I am Yvonka Hall, Executive Director of the nationally recognized Northeast Ohio Community Resilience Center, formerly the Northeast Ohio Black Health Coalition. And I thank you all for your time. And I'm going to see if y'all have any questions. And I hope y'all learned something. I hope you got something out of this conversation.
Thank you so much. If no one else has questions, I have a couple, but I also have some information to share. I had been in touch with Prince Pempton at the City of Cleveland's Department of Public Health because I know it's Smoking Cessation Month, I think, this month.
Young Awareness Month, yeah.
Yeah, and so I asked him if he could send a couple resources over, and we'll email those out. But I'm just putting a couple site one link in, and then a
And
website, and then a phone number to call. So to
yeah,
for
that's for their
yourself,
quit line. Yeah, so that's for
yes.
their quit line. So they do have that for people who smoke in Cleveland, Ohio. The Department of Health does have a quit line and a way for people to talk about smoking cessation. The other thing that I did not talk about that I want to make sure that I tell you all, since this is a holiday time and a lot of times people who normally don't drink will drink during the holidays. If you are a red wine smoker, I mean red wine drinker, and they're like cheaper bottles of red wine, the sulfates in the wine
Yep,
can cause you to have an asthma attack.
I've
And so
experienced it.
I've talked to doctors about that who did not know. And so I remember being in Cincinnati, and one of the doctors said, we keep getting all of these guys who are coming in with asthma attacks. And I said, are they drinking? And he said, yeah. I'm like, okay, well, they're probably drinking cheap red wines. And he said, what? And I said, yeah, the sulfates in the red wine are causing them to have an asthma attack. And um said, that was the first time he had heard of it. And so, but he and I keep up from that day because he said, I've been doing this for a long time and you told me something that I did not know. And so, I hope that you all found the conversation rewarding.
Well, and can you talk about, you gave us information about some things that we don't have a whole lot of control over except advocating for ourselves in our community for rules, regulations. But then there's these things that we can't control. So thank you for that. I wanted to ask about vaping and air fresheners too. So like, because
Yeah,
vaping would
yeah,
be
that would be
similar
like
to smoking.
vaping is the same exact thing as smoking.
Yes.
And so that would be, if I'm telling you not to smoke, vaping is the same thing. And and one of the things that I've seen lately is people vaping in places where they shouldn't be, because they think, oh, it's only vaping. So I'm standing there and I'm like smelling smoke, and I look around and a guy is vaping beside me, or I'm in Macy's walking through the store and somebody is walking through the store vaping. And so that is the same risk factor. The other thing is that if we're talking about scented candles, it would be the same thing with air fresheners, and things
Hmm.
like that. So if, I talked about perfumes, scented candles, air, anything that has a fragrance in it. If you have asthma or your child has asthma, I would tell you to avoid using those things. The same with dishwashing liquid. There's different flavors in dishwashing liquid. So that means that you're washing your dishes and you have like all of these other scents that are coming. And then now you're like, okay, ever since I washed the dishes, I haven't felt well. And it's because you're taking in all of it. Because nobody just use a little bit of dishwashing liquid. I haven't seen that happen. And so people are already overusing dishwashing liquid or the soaps that you have in your bathroom, or the hand washing soaps, or like the fragrance soaps, the other things that you're using on your person, using those on you can also be a trigger too. So
And then, any tips, things you've learned for how to advocate for your child? The incident that you talked about with an inhaler is something that happened to my son. It must have been some chemical that had been in one room in the school building. He had an attack and he had to run. He typically only has asthma triggered by strong chemical scents and things, mold, mildew, because it's not chronic at all. But um, we just we can use help with advocacy. But I'm also going to read this other question because I want to make sure we take care of this. Mom of a 4-year-old who has a diagnosis of asthma, cold and illness induced, started when she was 18 months old when I had to rush her to an ER for respiratory failure. She's been in the PICU four
mhm,
to five times since. She now has two different inhalers and oral steroid if we get bad to avoid the hospital. Now, with starting preschool, we had already missed a couple days because of breathing issues. She gets vaccinated for 4. Any research on holistic or natural helpers, elderberry syrup, or just something for respiratory health? We get told hopefully she will just grow out of it and it will decrease. Well, we heard from you that she won't grow out of it, except I know that it's manageable for me, and then for my son.
yeah,
So
for
how do we
manageable
help her?
are different things. And so there is no grow out of, so I just want you to know that she's not going to grow out of. And so the triggers may be less and less as you get older because your lungs have developed more so than when you're a child. But elderberry syrup, what I would say that anything that you're using, to talk to your doctor about it, because they can tell you the best things to use for your child. Because the crazy part about it is, for years, the African American community has used elderberry syrup, as a way for around colds and other things. And then they started putting elderberry in other things. So cough syrups, now you see them with elderberry. You see a whole bunch of things with elderberry. But they actually did a report and said that elderberry doesn't help. They actually released a report probably about 3 months ago,
Oh,
that said
yeah.
that. But then I don't know if the cough syrup industry are the people who release the report, because sometimes
Mm.
industries will release reports if they feel that other people are going to other holistic or traditional medicines instead of using theirs. And so they'll come out with a report and say, "Oh, you can't use that. You need to go back to using Vicks Vapor Rub." You know, and so I tell you, for you, having a child who's been in the pediatric intensive care unit, to make sure that you're talking to that doctor, that make sure that you're going to those doctor's appointments to look at the triggers, not only in your home, but in grandma's house and granddad's house, like in the other houses that your child may visit. Because sometimes we're like, oh, we've told our friends that, you can't do this around, and they forget because it's not their child. And so they may cook some things that trigger. Um, and so definitely talk to the doctor, and then make sure that it's an open conversation with your family, particularly if your child is visiting other family members or staying with an aunt, that they know what's going on. I was just watching a TV show earlier, and there was a young man in the show who had different types of allergies. And his soon-to-be stepmom didn't know. And so she went to go make something, and he said, "I can't eat that because I'm allergic to tree nuts." And she said, you eat peanut butter and jelly, peanut butter sandwiches all day. And he said, it's not a tree nut. And so they were having this whole conversation about it. And she said, she goes to the dad, I almost killed your son. I wasn't trying to, but I'm thinking, well, if he can eat peanut butter, he can have this. And so thinking about the other triggers and what happens when our children are away from us, because people may say, oh, well, your mom is not letting you have this. So let's see if we can give you this while you're here, because you're being withheld from home. So definitely talk to the doctor about any other type of holistic things. And also there are also other cleaning solutions that you can make yourself with vinegar. If you think about ancestral vinegar, ancestral cleaning, think about the things that your grandmother used. And for me, my great grandmothers who were born in 1907, they used vinegar. And so they used a lot of vinegar in order for them to clean things in their house. And so, because there wasn't a whole bunch of other things, but it's natural, is something that you can use that is not going to cause um, some of the issues that using some of the other heavy duty cleaners that we like to use will. So they definitely have, and you can look it up. If you say like natural cleaners and put that in, it'll tell you what kind of cleaners you can use for people with asthma.
And Yvonka, I have two other questions related to just that previous comment or answer. So one is, because this is a trigger for me sometimes, people who use strong scented laundry detergent and or um, like softeners, like I can smell people's clothing. That's a trigger for me. And I would think could be an issue for a child with asthma if they were wearing the clothes all day. And then second, um, do you recommend like that maybe someone have testing for environmental allergies if they're diagnosed with asthma? Is that something that happens
I don't
routinely or
think
no?
Yeah, I don't think that they would have to test for environmental allergies. If they know where you live, they know what type of other toxins are there in the air from where you live. Like they can literally look at on your zip code and say these are the things that are going on in the community. Now, the housing thing is a whole different thing. For for washing clothes, we know that people use all types of things. Some people they have all kinds of scents that you can use to wash your clothes. So if you have people in your house that have allergies, I would encourage you not to. I would encourage everybody not to use the things that have the scents on them. And so hopefully, Nicole, that's great to hear. That is great to hear. You know, and the natural cleaners are really good. And also with like toothpaste too, which can also, be a trigger because toothpaste, depending on what you're using, can have very strong scents. So thinking about that deodorants, depending on how
Mm.
little the child is, we don't have to use deodorant. But when they get a little bit older, and they're using deodorant, especially for our boys that all of a sudden smell like they have been out in the great outdoors forever. And so when we talk to them about using deodorants, making sure that they're using some things that don't have a lot of the scents on them, because those are the
Mhm.
scents that you smell, and that you smell, all the time.
Yeah. And I think a lot of people just aren't aware of it. Even scented lotions, things like that, anything with
I
those
talked about
perfumes.
the scented
Yeah.
lotions, and the soaps and the other things that people use, and perfumes, like perfume,
Yep.
any of those.
Perfume was and all those things.
Especially now, because this is the season of giving. And so one of the things that we do is we go over to the fragrance counter and we buy these gift packs because they're like really nice and they got like all of the stuff in it. And we give it, out to our friends, or if it's something for us to buy for like a secret Santa exchange, we go buy, you know, lotions and other things that are kind of like relatively cheap things for us to get. And those are the easy things. Like, oh, let me buy this because it's cute and it smells good. Um, and somebody says, I'm thankful for her inhalers now. We have them because they have saved her from the hospital. Yes, I just feel bad. It's our normal, and I get scared with every cold. I'm sorry that you get scared every cold, but I'm glad that you have the inhalers and that you are using them. You would be surprised how many parents don't. And I think before we end, I want to tell y'all one more story because I think storytelling is the best way to kind of get things across to folks. Because I read lots of books, and so telling stories, the whole booking thing. One of my cousins had asthma, has asthma, and had really bad attacks as a child. So when she was little, she would have these attacks, and she would have to go to the hospital, and she was just a baby, and I just felt so bad for her because I'm like, what the heck is going on here? Well, my aunt had bugs, and they would spray for them, and so
Mhm.
it was causing her to have these asthma attacks. So when they went to the doctor, nobody at the hospital ever asked them if they had bugs in their house. So just remember that when you go to the hospital and you are being triaged, I worked at a hospital for 10 years. And so I worked in social services. And one of the things we never ask anybody in triage is, do they have bugs in their house and have they tried to get rid of them? Like we never do. That is not a question. And so that can literally help save somebody's life because we can literally say to the parent while we're there, look, the things that you are trying to use to get rid of the bugs are causing your child to have an asthma attack. So we want you to not do that. So let's figure out some other natural ways that you can get rid of bed bugs and roaches without it causing an asthma attack for your child. But I just thought it was just the craziest thing because my little cousin would be so sick. And like she did have these machines on her. I would come to the house and they'd have the mask on her face. She's a baby. And they would be giving her these treatments and they're still spraying for bugs. So she would the treatments would be used to expand her lungs and get them going. And then a few weeks later, she would have the attack again. And the hospital would say, we don't know why she keeps having these attacks. We thought that we fixed everything. And it was like, yeah, you never asked her about her house. You never asked the family about the house. So that is my story for you.
I had one other question I put in the chat about humidity levels.
We talked a little bit about that at the very beginning. We talked about the extreme colds and extreme hots. So when I talked about this weather is changing and that we are going to be in the cold, and so people will walk out their house and go, oh, all of a sudden I can't breathe, or they start coughing. Um, so I would tell people to also make sure that they're wearing a mask, if they have asthma, because it can help them in those times when we have extreme weather patterns. Because now it's not so much around the humidity that we have to worry about except for if they're in the house and they have their
Or
on high.
or
Um,
lack of humidity.
yeah.
Okay. Yeah, and you don't want it to be too high because you don't want to have mold. Like you
Yeah,
have
and
to
you can
try
have
to
an air
strike a
purifier too.
balance.
So one of the things the Northeast Ohio Black Health Coalition did this summer is we sent out 1,000 air purifiers in our areas in Northeast Ohio
Mm-hmm.
to residents. We gave them away for free. We had them, we were able to acquire them through a program, and we tried to make sure that they got into the hands of people who needed them the most. So
Oh
thank you.
yeah, so that's another thing. I mean, I have a gas stove and I didn't realize how harmful it was, and now I put the vent fan on, but we didn't have a very good venting fan for a long time. And then I have an air cleaner in the kitchen and it goes red when I turn it on when I'm using the gas now, and it goes red. And but with the vent, like it's better than it would be. But I've noticed it in myself, so that's another thing. So thank you for mentioning that, and thank you for
You're
getting
welcome.
people air purifiers
Thank you.
and for the
Thank you for
advocacy.
listening. I appreciate it.
Um, does anyone else have any questions? It looks like maybe not, and we've fully electric household as of last Christmas. Very good. We're a ways away from being able to tackle that one because it takes there's other things involved, but it's coming for our family at some point. Um,
Hopefully, we
um,
can get the program back. We had a program to provide electric stoves to families here in Cleveland, and that money, I think it was like $6 million, was all pulled. And so hopefully we can, get those dollars back to families.
okay. Good to know. Um, so Ivanka, thank you. Oh, you went mute. Thank you so much for sharing your expertise. I hope people found this program to be helpful and that do you have any other place that you want to refer people if they need help? Like you said to their medical provider, essentially.
That's the best
So,
place for them to go because the medical provider is the keeper of all of their health information. And
okay.
so, besides that, they can look at the Lung Association, the Asthma and Lymphoma Association, The Ohio Department of Health, their asthma project, you can literally look up the asthma project. They have videos, short videos for you to watch too, that
Okay.
are really good for children. Yeah. They
Okay,
have some really
great. So if you need to learn more, those are all resources. Thank you again, all of you, for attending. If your children are struggling with this, we wish you the very best. We know full recovery might not be, it's not going to be cured, but you can get a much better quality of life and get it under control. And that is what we wish for all of you. Um,
And be careful this holiday season and all holiday season, particularly when we end up with like the pines and cinnamon in the stores. Like I remember
oh
having
yeah,
an asthma attack at
potpourri.
the store because I was walking past all of this pine and cinnamon. And so like making sure that you're recognizing where you're at.
Yeah, protecting yourself. So, thank you again. We will let you go for the evening. I put the survey link in the chat. If people can fill that out, that would be great. Oh, great. We're getting a little thumbs ups. That's very nice. I'm glad about that. Good, good. So, again, best wishes to all of you, yeah, as you enter the holiday season. And again, spread the word about Dolly Parton's Imagination Library. And everyone have a good evening and a good rest of your week. And thank you again, Ivanka.
Thank you. Have a great
All right,
one.
you too.
Bye,
Bye bye.
everybody.